Hello everyone, this is Dr. Hola Razouk. I'm going to introduce the topic about hepatitis and talk about the differences between hepatitis A, B, C, D, and E. We're going to focus on transmission, on the diagnosis, on the different forms of hepatitis, and some high-yield facts. So let's begin. Hepatitis A and E are the only hepatitis virus that have an acute form. They do not have a chronic form at all. They are transmitted through the fecal-oral route through contaminated food or water. To diagnose it is very simple. The marker IgM means that there is an acute infection. So, for hepatitis E diagnosis, it's going to be anti-HAV IgM, and for hepatitis E, it is going to be anti-HEV IgM. A key point distinction is that hepatitis E is very dangerous in pregnancy because it can cause fulminant hepatic failure, which is acute liver failure, and eventually lead to death. So to remember this, pregnancy in French means enceinte, and it starts with the letter E. So as hepatitis E, that is why this can be a way to remember that hepatitis E is linked with pregnancy, and it can lead to fulminant liver failure. Let's move to hepatitis B. Hepatitis B has both forms, acute and chronic. It can be transmitted via three main ways: via the blood, like intravenous drug use or needle stick, by sexual contact, or mother to child during birth. Since it can be spread to the newborn, that's why we give the hepatitis vaccine at birth. It can be given in 3 doses: at birth, at the first month, and 6 months. If the mother is HBsAg positive, which is hepatitis B surface antigen positive, this marker indicates that there is a virus present or that there is an infection going on. So if the mother is positive, so she is certainly infected, and we have to give to the newborn hepatitis B immunoglobulin within 12 hours. Let's talk about the serology markers for hepatitis B and make it simple. There are different markers. The first one I'm going to talk about is hepatitis B surface antigen. If this marker is present, first of all, we will do it. This means that there is a virus present, so there is an active infection going on. The infection can be acute or chronic, and I'm going to tell you how we could differentiate between acute or chronic. If there is anti-hepatitis B surface antibody, this means that there is immunity, which means that we have recovered from the infection, or we are immunized because we took the vaccination. Let's talk how we can compare between acute or chronic hepatitis B. Now, there is a core core antibody. So if there is hepatitis B core IgM, always if we see IgM, then it indicates that there is an acute infection. I'm going to talk this about the window period in a while. Anti-hepatitis B core IgG means that the infection is chronic, or that the patient has recovered from a past infection. So either chronic or recovered from a past infection. Anti-HBeAg, this means that the patient has a high viral replication, so the infectious rate is very high, and clinically meaning the patient is very highly contagious and can spread the disease very easily. The window period basically is when the hepatitis B surface antigen has disappeared from the blood. However, the anti-hepatitis B antibody has not appeared yet. So the only marker to indicate that the only marker that indicates this is the window period will be anti-HBC IgM, which confirms that there is an acute recent infection. This is very, very high yield. Please remember this. So let's apply the pattern, the different hepatitis B serology that we saw in this table. Now, we said that first of all, we will do hepatitis B surface antigen. If this is positive, means that there is obviously an infection going on. So now, first about acute infection. If this is positive, so this means there is an infection going on. We want to know whether it's acute. Acute, we said IgM includes that it. IgM means that it is an acute infection. And these markers will be negative. For chronic infection, obviously, as we said, if the surface antigen is positive, this means there is an infection going on. We want to know whether it is chronic or acute. We said IgG means it is chronic. And anti-HBS means that the patient has immunity. So still the patient has not the immunity here. The window period, we said the only marker that will be positive in the window period is the anti-HBC IgM, and everything else will be negative. If there is a prior infection, or which means that the patient has resulted from a hepatitis B infection, so the patient will obviously will not have surface antigen anymore, neither the EAG, and we said the IgG means either a chronic infection or that the patient has resolved from a previous infection. And obviously anti-HBS is positive because the patient is immune now. If we are vaccinated from hepatitis B, this means the patient is immune, so this marker will be positive and everything else will be negative. Please memorize this table because it is very high yield. Something very important about hepatitis B, that there are some extrahepatic manifestations. The most important one is polyarthritis nodosa. What is polyarthritis nodosa? Polyarthritis nodosa is a form of vasculitis that is associated with hepatitis B. So if a patient has hepatitis B plus some of the symptoms like fever, weight loss, peripheral neuropathy like tingling, numbness, or glomerulonephritis, please suspect of polyarthritis nodosa. Another extrahepatic manifestation of hepatitis B can be glomerular disease, mainly membranous nephropathy, which presents with proteinuria and nephrotic syndrome. Let's move to hepatitis C. Hepatitis C is mainly transmitted through blood by intravenous drug use. The most important fact about hepatitis C, it is that hepatitis C is highly likely to become chronic, about more than 80%. The diagnosis is made by HCV RNA done by PCR test. The most important point about hepatitis C that it has an extrahepatic manifestation like hepatitis B. So if you see hepatitis C, a patient in a case question diagnosed with hepatitis C, and the patient has purpura, peripheral neuropathy, Raynaud's phenomenon, glomerulonephritis, and a low C4 count, please suspect of hepatitis C. Cryoglobulinemia. How to remember that cryoglobulinemia is associated with hepatitis C? Hepatitis C starts with C. Cryoglobulinemia also starts with C. Very important point about this disease is that there is a low C4 count and it presents with cutaneous purpura. So cutaneous for skin, purpura because it has purpura. So as I said, if hepatitis C plus any of these symptoms, always think about cryoglobulinemia. Lastly, I want to mention about hepatitis D. Hepatitis D is a unique because it doesn't occur unless the patient has hepatitis B. It can be transmitted via two ways. Co-infection or super-infection. Co-infection means that hepatitis B and D occur simultaneously. Super-infection means that the patient has hepatitis B, and on top of that, you get hepatitis D. These are the main points about hepatitis D, but for treatment, there is a drug called pegylated interferon alpha. If you want, you can remember this drug for your own knowledge, as it can be asked in some exams. And if you find this video helpful, don't forget to like, subscribe, and share with your fellow medical friends. And thank you for watching. See you in the next lecture.